microbes and VCO and monolaurin. Why do I find it exciting? Because in fact, long before I decided to do studies on it, there's a longer history. It goes all the way back about lipids back in the 1800s. Lipids were talked about as important in the diet and important as an antimicrobial antibiotic, except that penicillin was discovered. And with penicillin, it's easier to synthesize a drug. And so the lipids actually went to the back ways. Remember, they were used as antimicrobials before. Bring it up to about the 50s and 60s and 70s, and Dr. Cabara in the United States, soon after followed by physicians researchers in Europe, started to study monolaurin, which is a monoglyceride of laurin that exists so highly in coconut oil. And those studies showed in the laboratory primarily that, my golly, this lauric acid and its monoglyceride have antimicrobial properties. There's a nice one, nice bug from Argentinian hemorrhagic fever, which is very similar to COVID-19. It also has glycoproteins penetrating the lipid bilayer, and with that, it produces crowns. That very effectively was killed off by the monoglycerides of coconut oil. And it's a much healthier antibiotic. It's not synthetic, it's just derived from a natural antibiotic, also in a natural product, coconuts. Monolaurin exists in breast milk as much as 16 to 18%. So it is a normal, healthy antimicrobial that can be used by babies, such that there are actually a number of very good studies on infants who are delivered premature, small, and giving them the coconut oil. One group, the regular feed, powder mix, and the other one just giving coconut oil, and fantastic. Significantly, those given the coconut oil were increased their weight and were healthier. Microbes in the skin contribute to its microbiota, which again are very important in, say, acne. Let's just give you an example. The microbiota that's natural in the hair follicle are a fungus called Malassezia, a bacteria called Propionibacterium acnes, and then also a mite actually lives in our follicle. And the thing is that if you continue to use antibiotics, which is usually the treatment for many years, it was oral antibiotics and topical antibiotics used to treat acne. But then you upset natural balance. And on the other hand, coconut oil being a natural food product that the body has learned through centuries as being a normal, or what we call a native fatty acid, or native things they break down into, it's not, it's not alien to the normal bugs that we have, and so they're only targeting the colonizers that come into the skin. My very first study on coconuts is actually after I met Dr. Cabara in Beijing, and he challenged me that I should do clinical trials, because I complained that his studies were just in the laboratory. When I came back, I was the chair of our department of dermatology at that time. I invited a group of hospital workers to join a coconut study. Coming out of duty in that general hospital, we first put their fingers in a glove that was filled with a culture medium for organisms to grow. And we followed that baseline control over time, up to 10 times, to find out what the effect of applying first coconut oil in one group or applying the isopropyl alcohol in the other group. The result was amazing to me. I said, oh my gosh. The monolaurin compared as well in its effects on the organisms that were cultured from to the isopropyl alcohol, with a difference. Those who had applied the isopropyl alcohol had an effect that was irritating on the skin, whereas those who used the coconut oil were amazed and really spoke up about how their skin felt nice and smooth and soft. There are many studies that support that, including the second study I did, again comparing the coconut oil with with isopropyl alcohol. This was even more complex methodology, and again in these people, they also showed again how effective the coconut oil monolaurin versus isopropyl alcohol. How they compared, they were about equal in the way they were able to kill microbes. And again, they all exclaimed about how amazing the softening effects was on their skin versus the dryness, roughness, itching. VCO is terrific because it's really the source for the monolaurin. It has about 50% more or less lauric acid. That's basically. And the thing is that there have been many studies that show how effective lauric acid is, and its monoglycerides, in particular the monoglyceride of lauric acid, in killing bacteria, fungi, and viruses. So I look into the literature, what kind of viruses, and it is amazing. Coconut oil, lauric acid, and its monoglyceride doesn't even choose whether it is a virus or a bacteria or a fungus. The interesting thing about the lauric acid and its monoglyceride is that when I reviewed the literature since 2000, when I started all my 1998 since I my studies, with the current literature, what happened, and on antiviral effect, it was amazing that they found more and more in both laboratory and a few clinical trials that they could actually kill viruses on envelope, on non-envelope, on RNA, on DNA type viruses, and in particular on a virus that causes Argentinian hemorrhagic fever, which, like the COVID, the novel coronavirus, has the same spikes. Glycoproteins penetrate the viral envelope and produce the beautiful spikes of this. In previous years, we were just talking about the disintegration of the lipid wall or envelope or whatever of the viruses. But now it's also been shown that it's, in addition to disintegration of the virus's covering, it also prevents the virus somehow to attach itself to the cells of the body. Plus another study, more into the deeper study of the virus, it also delayed or did not allow the propagation of the virus. So there now are a lot more studies on how the virus works, and it's there, it's clear. So clinically, in my own clinical studies, I've also shown a paper that the molluscum contagiosum, you may be familiar with it. Kids have those little bumpy little viruses on the skin, and adults from sex usually may grow them as condyloma acuminata in the bottom part of the body. We've shown also in our dermatological trials that it is very effective in eradicating them without the need for surgery or cautery or things like that. The antivirals are very effective, of course, because they are really well studied to find out what enzymes, what other things can be used to kill the virus. Unlike coconut monolaurin or lauric acid, whose action is more based upon the very special, the unique kind of fatty acids that are present in coconut oil, which is about 65%, what we call medium chain triglycerides, medium chain fatty acids. And these in particular are short, saturated, and are able to penetrate the cell membrane of lipids. The safety protocol for it recognizes the fact that COVID-19, about at least 75 to 85%, its first entry into the body, it's really through the skin and through the nose and through the mouth, mucosa as well as skin. So social distancing is important simply because majority of first entry into the body is through the skin and through the nasal as well as oral mucosa. So with that in mind, for my own as well as for my patients and for the clinic that I work with, as well as to my colleagues at the general hospital I'm with, I give them coconut oil to use. I teach them to use it just like it would be with the soaping. You know, you see in the drill of the soap, place it into the nails, go in between, go in like that, rub it in into the wrist and up to the elbows. Then I tell them to put it into the neck, the upper chest, neck, all the way to the face. And then I use my fingers to put it in, and then as it's in, I then inhale. Put it in, massage it gently, and then breathe in. Because coconut oil is acted upon very quickly by the lipases, the enzymes of the body that break down fatty acids, which are the active component. And after they've done that, I tell them to also get a little bit of it into the mouth, swish it around, gargle it, and whatever it may be left to swallow it. This is not for actual treatment because the dosage is different for when you use it as a daily care versus that the study we're going to be doing soon, which is to actually treat mild to moderate COVID positive cases. Comparing the coconut oil versus standard of care in quarantines. So another thing about coconut oil is that it gives quality of life. Like in our microbial study, the skin becomes nice and soft even though it's very strongly antiviral. And the same thing in damaged or inhalant allergies in the nose because of all the chlorine that we're exposed to, that we breathe in. It's a barrier repair oil. In my practice now, I often get referrals of very serious skin problems that haven't responded to the usual steroids or antibiotics or oral or internal or even the biologics. And I find that the reason for that in many times is that there's really barrier deficiency among those patients simply because for years they've been using steroid creams either as prescribed initially, but then they tend to continue it over and over and over again, somehow getting steroids and continue it for years. So they become secondarily infected with all sorts of microbes. I've cultured so many from these people, gram-positive, gram-negative organisms, fungi, scabies-like mites, and have to treat them one by one to be able to do it. And so what I do normally is I stop everything. You know, I said, you're in the hospital anyway. I'll put you in a dark room because you're barrier deficient and you're also photosensitive. And by putting them in a bathtub, soothing their skin, then applying the coconut oil all over the body, and giving them some of that coconut oil in the same way I was telling you about putting in the nose and what. They, within a few days to a week, they're feeling so much better because the quality of life is better when your organisms are beginning to become normalized and the absence of steroids. Thank you so much for listening. Stay safe. Follow the guidelines.